Mid-stage total hip replacement exercises. When the early stage exercises have become easier and feel comfortable, progress onto the mid-stage program. If you are unable to complete them in one go, you can break them up into individual exercises. It is normal to feel ready for the mid-stage program around 2 to 3 weeks after your surgery. Static exercise bike. If you feel confident and you have access to a static bicycle, you can cycle for between 5 to 10 minutes on low resistance for 3 days per week. We advise that you adjust the height of the saddle so that you feel comfortable. Towel squeezes at 0, 60 and 70 degrees of hip bend. Place a large rolled up towel between your knees. Squeeze your knees together to about 60% effort. If the squeeze is painful, squeeze a little less hard. Hold the squeeze for between 20 to 30 seconds and perform between 2 and 4 cycles as comfortable, once per day. 0 degrees of hip bend, 60 degrees of hip bend, and 70 degrees of hip bend. Double leg bridging. Lie on your back with your hips and knees bent, feet flat on the floor or bed, and your feet hip width apart. Lift your hips up and then slowly lower back to the start position. Perform 12 to 20 of these as able and 3 sets, once per day. Double leg bridge with alternate heel lifts. Lie on your back with your hips and knees bent, feet flat on the floor or bed, and your feet hip width apart. Slowly lift your hips up and hold, maintaining a still and level pelvis. Slowly de-weight one heel and hold. Keep your pelvis lifted and swap legs. Hold this position for between 5 to 10 seconds as able. Perform 5 to 15 on each leg, once per day. Lateral hip series. The clam. Lie on your side with your hips and knees bent. Keep your feet together. Lift your upper knee. Slowly lower the knee back to the start position. Feel the exercise around the outside of your uppermost hip. Perform 10 repetitions and 3 cycles of this once per day. Side lying hip abduction with a static hold. Lie on your side with your legs out straight. Lift your top leg up and out to the side and hold. And return to the start position. Perform 10 repetitions and 3 cycles of this once per day. Side lying hip abduction with small figures of 8. Lie on your side with your legs out straight, lift your top leg up towards the ceiling and draw a small figure of 8 with the leg moving from the hip. Exercises to be completed in standing. Heel raises in standing. Stand with your fingers resting on a wall or table for balance, feet parallel. Lift your heels off the ground to full height and slowly lower back to your start position. Perform 3 sets of between 12 to 20 repetitions, once per day. Hip bends in standing. Stand with your fingers resting on a wall or table for balance. Slowly bend one hip up towards you, ensuring that the bend is coming from your hip rather than your back. Bend the hip a comfortable distance. Perform 3 sets of between 12 to 20 repetitions, once per day. Mini sumo squat. Stand with your fingers on a table for balance. Feet apart and turned out. Stick your bottom out as you descend. Only descend a small distance. Perform 2 to 3 sets of 12 repetitions once per day.